Remember what our parents told us? Brush your teeth hard to get them clean. Or, losing your teeth is just a part of getting older. For decades, we took this advice as gospel. But what if I told you that some of the most common beliefs about our teeth are not just a little off, they're outright lies? In the next 60 minutes, we're not just busting 5 myths. We're uncovering the simple truths that dentists wish every patient over 55 knew. The first one might just change how you start your day. Welcome back to Silver Smile and Bites. Our mission is always to help you improve everyday vitality through simple, gentle guidance, and nothing affects your quality of life more than oral health. Believing misinformation about your mouth is expensive. It leads to painful, unplanned procedures, and it drastically impacts your ability to enjoy nutritious foods. For those in their senior years, these 5 dental lies are particularly harmful. They cause unnecessary worry and often lead people to accept discomfort or inevitable tooth loss. Today, we are correcting the record. We are restoring confidence and giving you the power to protect your smile for life. If you find clarity and value in this evidence-based information, please take a moment to click the like button. This signal helps us reach more mature adults who need to hear these vital truths about managing their health. The first major lie we need to fully dismantle is the most discouraging one of all. Losing your teeth is just a normal part of getting older. Many of us grew up watching older family members face tooth loss and eventually receive dentures. Historically, preventative dentistry was almost non-existent. Because tooth loss was common in those generations, it became associated with age. This association is incorrect. Your age does not determine the fate of your teeth. Your natural teeth can absolutely last your lifetime. But if you believe tooth loss is guaranteed, you become less motivated about daily care or skip preventative dental visits. This complacency creates the exact conditions necessary for the actual culprit to thrive. The real danger to your smile is not the passing of time. The true enemy is chronic inflammation and deep inflammation, specifically periodontal disease. This is a severe progressive infection of the tissues and bone that hold your teeth secure. It begins subtly as gingivitis, often visible only as red or tender gums that might bleed easily. If this is ignored, the harmful bacteria travel beneath the gum line, forming deep pockets. Your body's immune system mounts a defense, but this chronic battle begins to destroy the supporting bone structure around the tooth root. When that anchor fails, the tooth loosens and often falls out, or it requires painful extraction. This process is slow and often painless in the initial stages, which is why the lie that it is simply old age is so persuasive. But periodontal disease is a manageable condition at any age. The solution is early detection and absolute control over the bacteria in your mouth. What is the truth? You deserve to keep your teeth. What is the Silver Smile action plan to fight this lie? It involves integrating 2 essential, gentle habits into your routine. First, you must prioritize cleaning between your teeth. Brushing cleans the surfaces, but the primary source of the destructive gum disease and bone loss lurks where the bristles can't reach. If you experience challenges using traditional string floss due to arthritis, hand tremors, or diminished dexterity, there are excellent alternatives. Never use a physical challenge as an excuse to avoid this vital step entirely. Water flossers, for example, have become incredibly popular for seniors. They use a focused, pressurized stream of water to flush out food debris and bacteria, often feeling much gentler on receding gums. Another fantastic option is the interdental brush. These small brushes are easier to grip and manipulate than string floss and come in various sizes to perfectly fit the spaces between your teeth. Choose the tool that you can commit to using every single day. That consistent interdental cleaning is the strongest defense against the inflammation that destroys bone. Second, reinforce your oral health from the inside out. Studies strongly link the integrity of your jawbone to systemic health and nutrition. While brushing is a local effort, the stability of your tooth sockets relies on bone density. We are familiar with vitamin D and calcium for general bone health, but emerging evidence highlights a critical partner, vitamin K2. This nutrient is believed to help direct calcium efficiently to your bones and teeth, preventing its buildup in soft tissues. Supporting the structure that holds your teeth is a powerful way to fight the idea of inevitable loss. Consider dietary sources rich in vitamin K2, such as fermented foods. Always consult your doctor before beginning a new supplement regimen, but remember, nourishing your body internally is a core part of fighting this lie. You are actively taking control. Now that we understand the importance of gentle, consistent care of the gums, let's pivot to the second major misconception. This one involves the power we use every single time we pick up a toothbrush. The second destructive dental lie is this: brushing harder and using stiff bristles cleans your teeth better. If you were taught that cleaning requires significant force, the harder you scrub, the cleaner the surface, you are likely falling for this lie. Plaque is a soft, sticky film. It requires almost no force to dislodge. When we apply heavy pressure or use firm bristles, we are not cleaning better. We are damaging the two most important structures in our mouth. This damage happens slowly, silently over decades, and is the number one reason for increased tooth sensitivity as we age. The first type of damage is gum recession. Your gum tissue is extremely delicate. Aggressive, horizontal scrubbing gradually pushes the gum line back, exposing the underlying tooth root. Exposed roots are not protected by hard enamel. They are covered by softer cementum. This soft layer wears away quickly, leading to the painful jolts of sensitivity when you drink or eat something cold. Gum recession also makes teeth appear longer, the classic image of long in the tooth, which is actually not a natural sign of aging, but a mechanical injury caused by brushing too hard. The second damage is enamel abrasion. Your enamel is the hard, shiny, protective shell. Excessive force, combined with the mild abrasives necessary in toothpaste, literally rubs away the enamel over years. This thins the protective layer, making your teeth look duller and, critically, increasing their susceptibility to decay. What is the truth? Gentle polishing removes plaque perfectly. What is the Silver Smile action plan to correct this lie? Adopt the right tools and the right technique immediately. First, the tool selection. Use a soft bristled brush always. If you use a manual toothbrush, replace any medium or hard brush today. If you use an electric brush, confirm it has a working pressure sensor. These are invaluable devices that will flash or stop spinning when you press too hard, immediately training you to use less force. Second, perfect your gentle grip and the 45-degree angle technique. Stop holding the brush in a fist. This encourages heavy scrubbing. Instead, hold the brush lightly, almost like a pencil. This automatically restricts the pressure you can apply. Now, angle the brush head so the bristles point toward the gum line at a 45-degree angle. Use short, circular, and extremely gentle strokes. Think of it as massaging the gums while sweeping the plaque off the tooth surface. Focus on covering every area for a full 2 minutes. You will find that this gentle, deliberate method reduces gum irritation and sensitivity almost immediately. This simple change is one of the most powerful steps you can take to preserve your enamel and comfort. Now that we've established the necessity of gentle cleaning, we move to a problem for a massive segment of our audience, those with dentures, partials, or implants. The third major lie is this: if you have dentures or implants, you can skip regular dental visits. This assumption is based on the idea that if the original targets of decay, the natural crowns, are gone, the maintenance stops. This belief is not only wrong, it is extremely dangerous. Regular professional checkups are essential for 2 life-saving and long-term reasons, even if you are fully edentulous. Reason number 1 is bone loss monitoring. Dentures sit on your gum tissue. They do not provide the necessary stimulation to the underlying jawbone that natural roots or implants provide. Without that mechanical stimulation, the jawbone starts to resorb and shrink. This process is often rapid. If your dentist is not monitoring this change, your dentures will eventually fit poorly. They become loose, they rub, they cause chronic sores, and they hinder your ability to eat well. A regular relining of the dentures is essential to maintain proper fit, which helps stabilize your bite and slow down that progressive bone loss. Without those appointments, you are guaranteeing an ill-fitting appliance and accelerating the deterioration of your facial structure. Reason number 2 is oral cancer screening. This is the most crucial, non-negotiable reason for professional visits. Oral cancer can often be successfully treated if caught in its earliest stages, but it is frequently missed because patients without natural teeth stop seeing their dentist. During a checkup, the dental professional meticulously examines all the soft tissues of the mouth, the tongue, the cheeks, the hard and soft palate, and the throat. They are trained to spot subtle, non-painful indicators, such as unusual patches or persistent lesions, which might be precursors to cancer. This simple visual examination is a vital, life-saving service that cannot be performed at home. What is the truth? Your entire oral environment needs professional surveillance. What is the Silver Smile Action Plan? Integrate daily appliance care with mandated professional oversight. First, treat your appliance with specialized care. Dentures can harbor massive amounts of bacteria, yeast, and plaque, leading to bad breath and fungal infections like thrush. Never use regular abrasive toothpaste on your dentures. It scratches the surface, creating homes for germs. Use a dedicated denture brush and a mild cleanser, or soap and water. Most importantly, give your tissues a break. Your gums need rest and natural saliva cleansing. Remove your dentures for at least 6 to 8 hours every single day, typically overnight. Second, commit to biannual checkups, no exceptions. If you are a caregiver for an older adult who uses dentures, ensure these appointments are on the calendar. Use these visits to communicate any changes in fit or comfort, and always confirm that the dental team performs a full oral cancer screening. This simple 2-time-a-year visit is an investment that protects both your health and your dignity. We have addressed the large-scale risks of neglect and excessive force. Now, let's zoom in on a symptom that causes massive anxiety and often leads people to make the wrong choice in their daily routine: bleeding gums. The fourth major lie is this: if your gums bleed when you floss, you should stop flossing that area to let it heal. This lie is entirely understandable because it follows the basic logic of treating any other wound on your body. If you see blood, you stop the trauma. However, the dynamics of the mouth make this advice profoundly incorrect. When your gums bleed during cleaning, it is almost never because you are hurting healthy tissue. It is a clear sign that the tissue is already sick and inflamed. It is the signature symptom of gingivitis. Consider this scenario. A sticky film of plaque has built up along and beneath the gum line. Your body's immune system has sent inflammatory cells to the area to fight the bacteria, causing the tissue to become swollen, tender, and fragile. When your brush or floss finally disturbs that area, the fragile tissue bleeds easily. If you stop flossing, the bacteria remain undisturbed. They continue to multiply, and the inflammation only worsens, inevitably advancing the problem from simple gingivitis to destructive periodontitis. Stopping the cleaning simply allows the infection to deepen and spread. What is the truth? Bleeding gums are a warning light indicating inflammation, and gentle, thorough cleaning is the required treatment. What is the Silver Smile Action Plan? Remain consistent, stay gentle, and pay attention to improvement. First, flip your mindset. The bleeding is a sign you need to be more diligent, not less. Address the area with extreme gentleness but increased focus. You must continue to clean that area every day to remove the bacterial irritant. In most cases, if you clean thoroughly and gently, the bleeding should subside significantly within 3 to 5 days. If you maintain this consistent care for a full week and the bleeding persists, then that specific area needs professional attention, as it may signal a deeper issue. Second, perfect the gentle flossing technique. Avoid snapping the floss down into the gum tissue. Instead, guide the floss gently down to the gum line and then wrap it into a tight C shape around one side of the tooth. Slide it carefully below the gum line until you feel slight resistance. Now use 2 or 3 gentle, smooth motions to scrape up and down the tooth surface. Repeat on the adjacent tooth. If you were using a water flosser, use a low to medium pressure setting to ensure you flush the area without causing undue trauma. The goal is to flush out the irritant. Stay gentle, stay consistent, and the inflammation and the bleeding will retreat. We have covered the physical risks of pressure and neglect. Now let's turn our attention to the foods and drinks we consume. This final lie traps many health-conscious adults who believe they are making smart choices. The fifth and final destructive lie is this: sugar-free drinks like diet sodas or flavored sparkling water are safe for your teeth because they don't contain sugar. This is a partial truth, and that makes it exceptionally misleading. Eliminating sugar is excellent, as sugar feeds the bacteria that cause cavities. However, cavities are only one form of dental destruction. The other major threat is acid erosion. Many drinks marketed as healthy, diet-friendly, or refreshing are highly acidic. Acidity is measured on the pH scale, where 7 is neutral. Tooth enamel begins to dissolve when exposed to environments below a pH of 5.5. Most diet colas, flavored sparkling waters, fruit juices, and even that slice of lemon in your water have a pH as low as 2 or 3. This acid immediately starts the process of demineralization, weakening the hard enamel surface. If you sip these acidic beverages slowly throughout the day, you are constantly exposing your teeth to an environment that strips away their protection. This chronic attack is often more damaging than consuming a single sugary item that is quickly cleared by saliva. What is the truth? Acidity is a huge threat, and the frequency of exposure is the critical factor. What is the Silver Smile action plan to minimize the damage from acid? We use a 3-step protective strategy. First, use a straw and consolidate your consumption time. When drinking anything acidic, be it iced coffee, sparkling tea, or soda, use a straw to help bypass the front surfaces of your teeth. More importantly, try to drink the entire beverage within 15 to 20 minutes. This limits the exposure time. When the acid exposure stops, your saliva can begin its natural job of neutralizing the pH and restoring minerals. Next, rinse immediately with plain water. After finishing any acidic food or drink, quickly take a sip of tap water and swish it vigorously around your mouth for about 30 seconds. This simple act washes away the residual acid and rapidly helps the oral environment return to a neutral, safe pH level. This is easy, free, and incredibly effective protection. Third, wait 30 minutes before brushing. If you brush immediately after consuming something acidic, your enamel is temporarily softened and weakened by the acid. Brushing at this point literally rubs the softened surface away. Wait half an hour. Give your saliva time to naturally reharden and stabilize the enamel before you apply any mechanical friction from your brush. These 3 simple adjustments allow you to manage the risk without sacrificing your preferred beverages. We have systematically analyzed and corrected the 5 most damaging dental lies. These simple, evidence-based truths give you back the control you may have felt you lost. Before we conclude, let's address 2 common concerns for mature adults. First, dry mouth. Many essential medications for conditions like hypertension, diabetes, or depression list dry mouth as a side effect. Since saliva is your body's essential neutralizer and protector, dry mouth dramatically increases the risk of both cavities and severe erosion. This is not a myth, it is a critical vulnerability. The Silver Smile strategy here is multifaceted. Talk to your prescribing physician about medication alternatives. If switching is not possible, commit to sipping plain water constantly throughout the day. Use over-the-counter saliva substitutes as needed, and choose sugar-free gum containing xylitol, which encourages saliva flow and actively reduces cavity-causing bacteria. Second, sensitivity around older dental work. If you experience sensitivity or pain near old fillings or crowns, the problem may be structural. Believing lie number 2, for instance, and brushing too hard may have damaged the seal or margin around an old repair over time. This creates a tiny gap where bacteria can invade. This is not a situation you can fix with home remedies. If you feel a sharp edge, pain, or notice a visible gap around a restoration, see your dentist promptly. These issues often require only minor repair or polishing, but addressing them early saves you from a massive, costly procedure down the road. Protect the investment you've already made in your smile. Achieving outstanding oral health in your later years is not about buying expensive gadgets or subscribing to complex treatments. It is about knowledge, consistency, and showing your mouth the kindness it deserves. It is about understanding that you are not destined for decay or discomfort. You have the truth now, and with that truth, you have the power to maintain your natural teeth and feel confident in your ability to eat, speak, and smile for the rest of your life. The simple, gentle adjustments we discussed today are your defenses against those outdated lies. If this guide helped you uncover just one lie you were believing, please click the like button and subscribe to Silver Smile and Bites. We create new, evidence-based guides just like this one every week to support your health journey. Be sure to hit that notification bell so you never miss our crystal clear, step-by-step guidance. Now that you have the truth, pick one habit, perhaps the spit don't rinse rule, or switching to that soft bristled brush. Start making that small, gentle change today. You deserve to take back control of your health and vitality. Keep smiling brightly because your best years are absolutely right now.